Hi, this is Zach with the Retail Division in the HR Department. Today we're going to be going over your Employee Benefits and Wellness Program for the 2019-2020 plan year. In this presentation, we're going to be going over a few key features of the Retail Division Benefits Program. This includes an overview of the Benefits and Wellness Portal, which you're on right now, a complete overview of all of the different lines of coverage offered on the Benefits Program, going through the Employee Guide page by page, an overview of the new wellness program with United Healthcare that we're rolling out for this plan year, as well as some resources available to you, including important contact information and some different programs that we have available to us as for employees at the retail division. So first and foremost, we just want to welcome everybody to the 2019-2020 plan year. We're really happy that you have gotten this far and you're watching the video and getting educated about our benefits. You know, benefits are one way that we can show all of our employees how important they are to us by offering, some rich and robust benefits that we ultimately hope that everybody is using and taking full advantage of, because we find when people are participating in the benefits program, they're going to the doctor, they're using the new wellness program, they're out there, they're being healthy, they're being happy, they're ultimately more productive workers. And everybody's happiness and productivity is going to be paramount for us. So we do implore everybody to take full advantage of the offerings in the benefits program. And if you have any questions at any time, please reach out to the HR department so that we can get you involved. So something new that we wanted to add this year was the Benefits and Wellness Portal, which is where you are right now. Everybody can access the Benefits and Wellness Portal, on a computer, from their phone, from their tablet, simply by going to www.retaildivisionbenefits.com. We like to think of this as your one-stop shop for information related to the Benefits and Wellness Program. On the portal, you'll see that it has three different tabs. The first tab you're on right now, you're watching this video. This is the Wellness and Benefits Overview video. On that second tab are resources available to you. We're going to be updating these resources throughout the year, providing you guys with online copies of your benefit guides, information related to the wellness program, important documents. Maybe as we continue throughout the plan year and we all update our wellness goals, we're going to be able to host things like nutrition information and different programs. So kind of check back every now and then to that resources page on the second tab in order to keep up to date with everything that we're doing as it relates to your benefits program and the wellness program. The third tab is going to have the wellness questionnaire, which I'll talk about a little bit later in the video, but this is going to be a requirement for the wellness program, making sure that you answer this wellness questionnaire, letting us know what your wellness goals are, and ultimately step one in you earning some money towards funding your health savings account by participating in the wellness program. And on this slide right here, you'll just see this is kind of what the home page looks like. Right now, this is clicked onto the resources tab. You'll see, like I said, we'll be updating that. But that 1, 2, and 3, you'll be able to see those three different tabs there if you're not already familiar. So perhaps most importantly, let's give an overview here of our different benefits that we have available to us this year. To do this, we're going to be using the employee guide. All the employees who are insurance eligible should have a copy of this available to them. If you would like a hard printed copy, please just contact the HR department. We'd be happy to send you out one. This benefit guide is also going to be available under that resources tab at www.retaildivisionbenefits.com. And when you're using this guide, this is going to be that one place where everything is consolidated into one booklet talking about all the different benefits that we have here. It's going to be your medical insurance, your dental insurance, your vision insurance, your life insurance, a bunch of information about the new wellness program, other medical resources as they relate to state medical assistance programs, as well as some pretty neat work-life benefits that are available to you at no cost just by being a member at the retail division. So before we talk about the benefits themselves, let's talk about who's eligible for benefits. A person who's eligible for benefits is going to be a full-time employee who's working 30 hours or more a week at the retail division. We do have two different definitions of employee classes. Class 1 employee is going to be an hourly employee who has met the annual hours requirement of 1,560 hours over the last 12 months and has worked for the companies for less than 3 years of continued service. A Class 2 employee is going to be a general manager or assistant manager, and employees who have met the annual hours requirement of 1,560 hours over the last 12 months, but have been with the company for more than 3 years. For new hires and people who are newly eligible to the program, we take a look over a 12-month standard measurement period to see if they've worked an average of 30 hours a week or 1,560 hours over a 12-month or 52-week period. Once an employee is deemed eligible for coverage, they will get notified by HR, whether it be through actual mail to their home, a phone call, or email, that they have became eligible, and then they'll enter into a 30-day administration period where they'll be able to fill out their paperwork and make their elections for enrollment, and then will ultimately be enrolled after that. So for someone who's just coming on the plan, just a brand new hire to the group, it is going to take, in most cases, unless you're a manager, 12 months to become eligible, where you're working 30 hours a week for that entire 12-month period before you can be eligible for the benefits. From time to time, you may see some terms that you're familiar with, but maybe don't quite understand what they mean. We have a lot of jargon in health insurance, so we want to take a second to just make sure that everyone understands some of these important terms that we're going to be throwing around. Things like your deductible. That's that money that you pay before the insurance quote unquote kicks in. You do have to pay out of pocket before your plan begins when you're talking about the deductible. Coinsurance is going to be a cost share with the insurance company, usually presented in a percentage. So in the case that if you have a $100 bill from your doctor's office, you would pay 20% of that bill, meaning you'd pay $20, and the insurance company is going to pay that other 80% or $80 of that bill. Your co-pays are going to be a flat fee that you pay for certain in-network services. These are going to be the things where when you go to the doctor or the urgent care center or something like that, you're just paying a flat dollar amount, that $50 office visit, that $75 visit to the dermatologist. These are your co-pays, and they generally take place after your deductible. Your out-of-pocket max is very important. This is going to be the most money that you would ever pay all year long for your benefits. What this means is that in totality, in aggregate, every time you spend 1 penny towards your health care costs, it chips away at this out-of-pocket maximum number. When that amount reaches zero, everything is covered 100% for the rest of the year. Remember that your deductibles, your co-pays, your co-insurance, all of that is considered in your out-of-pocket maximum, and every time you spend any money, it chips away at that amount. So your out-of-pocket max is the most you would ever have to pay all year long before your services are covered 100% for the rest of the year. Okay, so let's take a look at the health insurance, and particularly let's start out by talking about the network. Our health insurance is still going to be with United Healthcare this year, and we're going to continue to use that Optimum Choice HMO network. Optimum Choice HMO network is referral based, which means that you do have to designate a primary care physician in order to see other doctors. The reason why we have these referrals in place and we use this primary care physician model is that it does allow us to offer lower premiums compared to what's called an open access plan. So you do need to get referrals from your doctor, and you do need to make sure that your doctor that you're seeing for getting those referrals is in network with the Optimum Choice network with United Healthcare. If you do not get referrals from your primary care physician, you may find that services are not going to be covered, and you may result in unpaid claims. This plan does not feature any out-of-network coverage, so you do need to seek care that is in-network by going to United Healthcare and finding providers that are in-network, getting those referrals and going in-network. If you do go out of network, you may be responsible for 100% of those costs. We're proud to offer the OCI network because it is a pretty robust network in Maryland, DC, Virginia, Delaware, West Virginia, and we're happy to say that over 30,000 doctors, 200 hospitals, and 3,500 retail pharmacies do participate. So you should have no trouble finding a provider that's in network. But the most important thing with your network this year, that Optimum Choice OCI network, is that you need to designate your primary care physician, and you do need to get referrals from them. So taking a deeper dive into your primary care physician, remember, you must get referrals from your primary care physician before seeing other doctors. Everyone has the right to change their primary care physician as much as they want during the plan year, so you can shop around a little bit, find the provider that's best for you. But I do just want to take a second to highlight how to go about finding a primary care physician. And this, what I'm about to talk about here does apply to other things as well. If you need to find a dermatologist or a cardiologist or something like that, you can use this same methodology to find them. So what it's going to be going to myuhc.com, choosing the Find a Provider, and then going to the medical directory. After that, you're going to click on All United Healthcare Plans. This is the important part, is making sure that you scroll all the way down to the bottom to where you see the Optimum Choice HMO. That's your network that you have. Can't use any other networks because you may find that you're using doctors that aren't in your specific network. So do make sure that you're on the Optimum Choice HMO network. After that, you can choose people, and if you're looking for a primary care physician, you would just choose primary care physicians. If you're looking for a dermatologist or a place to go get some x-rays or some blood work, you would just make those selections then. But if we're looking for a primary, you're just going to select that primary care physician and then show all primary care physicians. After that, you'll be able to search through the results based on your area. You'll be able to use filters such as your zip code, how far you want to travel, if you want to use a certain hospital system, things like that. After that, you'll come up with a list of all the providers' names and the provider ID. As far as designating your primary care physician, when you're making your initial enrollment or you want to change it, it's just a matter of letting United Healthcare or the HR department know that you're updating your primary care physician, and we'll just need their name and their provider ID in order to make those changes. Before we talk about the actual benefits themselves, I do just want to remind everyone that we do have a health savings account available to all employees. This HSA account is going to be pretty important this year when we start to talk about some of the great rewards you can get by participating in the wellness program. But the health savings account is available for everyone, whether you participate in the wellness program or not. And basically what a health savings account is, it's a special bank account where you can put money into pre-tax to help pay for qualified medical expenses, which I'll talk about on the next slide here. The big thing about the health savings account is that the money does go in pre-tax, which is great, which means that you're able to put that in before your taxes are taken out from your payroll. And this is your money that you're putting into your bank account that you can use towards your doctor's office. So because we're already taking advantage of a plan with lower premiums, you may find that some of the savings that you're getting compared to other plans that you may look at, you're able to take that money and kind of invest it in your health care by putting it into your health savings account to pay for some of those things like your dentist visits, your eye doctors, and even things like trips to the pharmacy and your regular doctor's visit. It's just one example where you can, kind of be a little bit smarter in your healthcare by not paying more to the insurance company and kind of paying yourself back for these services we use most often. So we encourage everyone to take advantage of the health savings account in some capacity, particularly using the wellness program to kind of front load your HSA with some money without even putting any in out of your own pocket. Talking about some of the health savings account qualified expenses, I did just want to highlight a couple of them. It's things like going to the chiropractor, getting your eyeglasses, getting medicines, going to the optometrist, surgeries, lab fees, hospital services, home care. All of these things may not come up too often when you're looking at just your regular summary of benefits for your health insurance, but all of these things are qualified expenses for your health savings account. So even though your health insurance may not cover acupuncture, or something like your hearing aid or something like that, getting a wig or a wheelchair, whatever, you are able to take the advantage of having your health savings account through your health insurance plan and the money that you've put into it pre-tax to help pay for some of these fees. So it's an example where your HSA is going to work for you even outside the scope of your regular health insurance. So just taking a look at our medical benefits real quick, the big thing that I want to start out with, that all of your preventative care is going to be covered at 100% and no cost to you. Regardless of the deductible and the out-of-pocket max, things like that, all of your preventative care is always covered at 100% for you and your dependents on the plan. These are going to be things like your annual adult routine physical or checkup, that one time during the year when you go to the doctor to make sure you're doing okay, make sure everybody's healthy. Your annual OBGYN visits, your children's well care visits, like your children's checkups, are going to be covered at 100%. Remember that this does vary per the age of the child. For example, a newborn baby is going to have the ability to go to the doctor and it be covered at 100% more times than, say, a 12-year-old. A 12-year-old is just going to have that one-time annual adult routine physical that they're going to have covered at 100%. Things like cancer screenings and mammograms, anything preventative is going to always be covered at 100%. Outside of your preventative care, we do want to remind everyone that this is a high deductible plan. That's what qualifies it for the HSA. So a lot of the benefits that come with using the HSA does mean that we do have to have a high deductible plan. This year, the deductible is going to be $5,000 for the individual, $10,000 for the family. With your deductible, remember that your deductible is always going to come first, and you're going to be responsible for 100% of your out-of-pocket cost until that $5,000 is met for the individual. After that, we'd be looking at a 20% cost share with the insurance company after your deductible. So for most of the other services, as you see down there in the middle, is that it is a 20% cost share with that 20% co-insurance, meaning when you go to your doctor's office after your deductible is met, that you're going to be responsible for 20% of the bill, the insurance company is going to pick up the other 80%. Your deductible and your coinsurance all goes towards your maximum out of pocket. Once your max out of pocket is met, everything's going to be covered at 100% for the rest of the year. Your max out of pocket for this year is going to be $6,650, which means that after your $5,000 deductible and your 20% coinsurance, once you hit that $6,650 in aggregate in total for the whole year, everything's going to be covered at 100% until the plan renews on October 1st, 2020. The big thing to keep in mind with the deductible and things like that is that we should be using our health savings account to pay for these out-of-pocket costs. Once we talk about the wellness program and the ability to get some HSA money up front without having to actually put any of your own money into the health savings account, you'll see that you are going to get a decent chunk of that deductible taken care of just by participating in the wellness program, which we encourage. So new for this year is going to be our company-wide wellness program through United Healthcare called Motion. This is going to give everyone the opportunity to earn up to $1,845 in HSA funding just by walking, just by participating in this wellness program. The first $750 of that are going to be provided by the retail division. You're going to be able to earn up to $500 of that just for doing two simple things: watching this video and completing the questionnaire on tab 3 of the benefits portal, and getting your annual checkup and just proving that to HR. So that gets you your first $500. The last $250 is going to be able to be earned by participating in the Motion Wellness Program with United Healthcare. Once you're in the Motion program with United Healthcare, you're going to be able to earn up to $3 a day with an annual max of $1,095 into your health savings account by accomplishing 3 easy goals. These 3 easy goals are reset every day, and the acronym they use for it are FIT, F-I-N-T, for frequency, intensity, and tenacity. Your frequency goal is going to be 500 steps in 7 minutes, 6 times a day. The I for intensity is 3,000 steps in 30 minutes, and the tenacity goal is 10,000 total steps. If you're able to do all 3 of these things in a day, you're going to be able to earn $3 a day from United Healthcare into your health savings account. So that's potentially $1,845 of money into your health savings account without you spending a dime to put in it. So how does this program work? So the wellness program with United Healthcare through Motion works by you actually wearing a fitness tracker like a Fitbit or a smartwatch or something like that. Something that can track your steps, can track your activity. Some of you may not have a tracker already, so one is actually provided to you at no cost from United Healthcare. How that works is once you sign up to the program, you log into your United Healthcare Motion website and you're given a $55 credit. That $55 credit can go towards your fitness tracker. They do have some that cost $55, which is great. So you can get a fitness tracker at no cost to you. They do have some that are more expensive, things like Apple Watches and smartwatches and things like that you can put your $55 towards and kind of work on against your goal to earn those. Or you can bring your own device, if you already own a smartwatch or an Apple Watch, something like that, to the program yourself, and you'll just have that $55 credit into your account. But I want to let everyone know that they can get the fitness tracker and participate in this program at no cost to them. United Healthcare will provide the fitness tracker for you if you do not already have them. Once you get your tracker, you're going to be going to the Motion app, downloading the app, and syncing your device to the app. Once you have the device and the app synced, you'll be able to start working on your goals every day. With your goals, you'll be able to start walking, and it'll be tracking your steps while you're walking or moving about, just doing what you do at work, just being on your feet, being active, being at work. You don't need to be going to the gym. This is something you can do just while you're at work, going about your regular duties. Once you're doing that, it's going to start to look for you accomplishing your goals, those F-I-N-T goals, that 500 steps in 7 minutes, that 3,000 steps in 30 minutes, and that 10,000 steps total for the day. If you're able to accomplish all those every day, you're going to be earning $3 into your health savings account. This is going to be a great benefit to you because, without you doing anything, just by going about your regular day, you could potentially be earning money for your health savings account without having to put any money of your own into it. So by doing this, when it's all said and done at the end of the year, you are going to be able to have some money in your health savings account that you can help use for your qualified medical expenses. Even if this is money that at the end of the year is when you're really making your final push, you're earning that money. These any out-of-pocket costs you have can be reimbursed with your health savings account. So don't be discouraged that it's only $3 a day, because you can even pay yourself back with this money. We encourage everyone to participate in this wellness program simply because it comes at no cost to you, and it's a great way to kind of front load your health savings account with some money without spending any of your own money in it. And, it's going to, hopefully give you some incentive to, be healthy, be active, and get moving. So a few things to go over just about the wellness program is you must be enrolled with the health insurance plan with United Healthcare at the retail division in order to participate in the wellness program. If you have your own insurance outside of the retail division, that's great, but unfortunately you are unable to participate in the wellness program with us. You also must have an open health savings account to participate in the wellness program. If you don't already have an HSA, please just contact the HR department and they can give you information on how to enroll. You also must be enrolled with the United Healthcare Motion Program. Just because you have the health insurance with us and you're enrolled in a health savings account and you have a Fitbit doesn't mean that we're tracking your steps. You do need to be actually enrolled with the Motion Program, using the app and having your tracker sync at least 1 time a week in order for United Healthcare to track your steps. All of the funds that you earn, that $3 a day, are paid out in quarterly sums. So every quarter, every 3 months, you're going to be getting your payout. All of these contributions, so the $3 that you're earning, the $750 you could potentially be earning from the retail division, and then all of the money that you're putting into your health savings account on your own, they are all subject to the IRS limits for this year. And to be in this wellness program and to get the most benefit out of it, you must actually be participating. If you aren't up and moving, you aren't wearing your smartwatch, if you aren't taking your walking and your steps seriously, and you're not participating, you're not going to be earning any money. So at the end of the day, remember that it pays to walk. Taking a look at the dental insurance, 2 really great dental insurance options which should serve everyone really well in this area. For the 2 dental plans, we have the value option on the left and the upgrade option on the right. The plans look pretty similar for the most part, especially when you're looking at that in-network coverage there. The big thing that I want to focus on is in-network costs, because the plans are pretty similar. You will see that generally speaking, the value plan is going to cost less out of your paycheck than the upgrade plan. So take a look at that annual plan max, that calendar year maximum. What that is that's the most money that your dental insurance is going to spend towards your services. It's going to be, think of it as money in the bank that you have with the dental insurance company. On the value plan, they're going to spend $1,000 per person. On the upgrade plan, they're going to spend $2,000 per person. So right away, you see that the upgrade plan, if you need to have a lot of work done, the upgrade plan may serve you better. However, if you take a look at the in-network column, you'll see that the plans are identical. So if you're going in-network and you don't need a lot of work done, the value plan is going to serve you just well. You're going to see that same coverage in-network as on the value plan as the upgrade plan. So if you're able to go onto guardiananytime.com and find an in-network provider and that's who you're using, you'd be just fine being on the value plan. However, if you do need to go out of network, you'll actually see that the out of network benefit on the upgrade plan is a little bit better. This is because of that thing down at the bottom where it says out of network reimbursement in that last line. On the out of network plan, on the upgrade plan on the right, it says that UCR 90, which means that 9 out of 10 times the out of network benefit is going to be reimbursed at that true 80% amount, that true 70% amount, that true 40% amount. Whereas on the value plan, even though that the percentages of reimbursement are higher, it's based on a fee schedule. So what it's saying is that it's going to pay 100% of whatever they determine on that fee schedule. So you may find that on your cleaning, which normally costs $150, that they're going to pay 100% of $50. So they'll give you 100% of that $50 that they have on the fee schedule, but that's it. You're left with a balance bill there of $100 remaining. On the upgrade plan in that same example, your $150 cleaning, they're going to pay, they're always going, 9 out of 10 times, 9 out of 10 dentists, 90 out of 100 dentists, they're going to pay a true 80% for the cost of that. So you'd actually find that your cleaning in that $150 example is covered more, even though they're only paying 80%. So all that to say, if you're taking a look at the differences between the 2 plans, it comes down to a couple different things. I would choose the value plan if you're willing to stay in network and you want to spend less money per paycheck and you don't need a whole lot of dental work done. However, if you're someone who does need a lot of dental work, or you do plan on going out of network, going to a dentist that doesn't participate with Guardian, which is a reality. A lot of dentists don't participate with Guardian or any insurance company just because they don't accept dental insurance. We do encourage you to take the upgrade plan. You'll probably see more savings in the long run if you're going out of network or you need a lot of dental work done. Really great vision plan with Davis Vision. Put most simply, you're looking at $60 out the door, $10 for your exam, $25 for your lenses, $25 for your frames. This is going to get you a basic pair of glasses with your frames costing up to $130. With the vision plan, you're going to have no trouble finding an in-network provider. Most providers are going to be in-network with Davis Vision, but I do encourage everyone to go to Guardian anytime and find an eye care provider. With this plan, it does encourage you to go to a standalone eye doctor. Think of Dr. Smith or something like that on Main Street, as opposed to something like Walmart or Sam's Club or BJ's or one of these big, value vision centers. The only reason for that being is that, and you'll see down there at the bottom, is that sometimes that the cost at Walmart and Sam's Club and things like that are already so low and so heavily discounted that you're not going to get the full benefit of the insurance. So if you are enrolled in the vision insurance and you're using it, just make sure to find a provider from GuardianAnytime.com. Again, you shouldn't have any trouble finding the doctor that you want to use in your area, but it's just worth to take a look if you're on the vision plan. But really great vision plan, should have no problem finding a provider and getting your glasses at an affordable price. Life insurance. So all eligible employees receive a $5,000 accidental death and dismemberment benefit at no cost to them. This is an employer paid benefit that everybody gets when you become a full-time insurance eligible employee. What this benefit is it's going to pay $5,000 to your beneficiary if you were to die in an accidental death. Pretty much anything other than taking your own life or dying of natural causes. This benefit is just a nice way to say thank you to everyone for all their hard work. Everyone gets this benefit regardless of if you're enrolled in the health insurance or the dental insurance or the vision insurance. Doesn't matter. You don't need to be enrolled in any of that in order to take advantage of this benefit. Everybody gets it just for being a full-time employee, and when you become insurance eligible, you're enrolled in this automatically. This benefit lasts for as long as you work here at the retail division. You do have the option to buy more life insurance for yourself, your spouse, or your children, up to $250,000. The thing to remember with this life insurance is that it may require medical underwriting or an evidence of insurability form, unless this is your first time enrolling and you're a newly eligible member. If this is your first time enrolling in the life insurance or the first time you're being offered these benefits, you do have guaranteed issue rights to get the life insurance with amounts for the employee up to $50,000 without any medical questions asked. Members can update and change their life insurance amounts at any time, but remember, after your initial enrollment period, it is going to be subject to that medical underwriting, and you will have to answer those simple yes/no medical questions on the evidence of insurability form. With your optional life insurance benefit, you do have a portability and conversion options available to you if you were to ever leave employment. Please contact HR if you have any questions about that. Life insurance rates are based on the employee. So please just keep in mind that if you're buying life insurance for your spouse and they are older or younger than you, that you're going to be going off your age as the employee. Life insurance rates do increase every 5 years. So every time that your birthday or your age at the current time ends in 0 or 5, just know that your life insurance is going to go up for that year for the next 5 years. A few additional benefits we wanted just to talk about. This is available to everyone just for being part of the program, all eligible employees. You do have a work-life benefit, an employee assistance program from Work Life Matters with Guardian. This is a great benefit that we encourage everyone to take advantage of, just because we know that, sometimes, balancing your work life with stresses and things like that can be difficult. So if you're finding that you're having something like marital problems or stress-related problems, parenting issues, problems at work, you're looking for child care or elder care, you're having substance abuse, addiction, or alcohol problems, financial problems, mental health issues, we do have counselors available by 24/7 by calling the 1-800 number listed there. This comes at no cost to you, even the opportunity for some in-person visits if need be, all available from Work Life Matters. So do take advantage of this if something like this applies to you or one of your dependents. Do also want to highlight some prescription drug pricing tools. The cost of drugs can be expensive, so we encourage everyone to check out sites like GoodRx.com to look look for manufacturing coupons from their prescription providers, just because you may find that even after the insurance there are some better deals, some manufacturer coupons, some good from GoodRx.com, things like that you can get to help offset some of the cost for your prescription drugs in your insurance program. I did just want to highlight some other insurance options for some members out there. This information information is going to be good for really anyone who's watching the video, but particularly anyone who may benefit from medical assistance services from their states. Health insurance may be available to you from your state at a reduced cost for low-income households, particularly those with children and pregnant women. If at any time you think that you may qualify for one of these, we encourage you to reach out to your local health department. While these plans are not affiliated in any way with the Retail Division Benefits Program and subject to all state guidelines, we do want to make this information available in case this is something that applies to your household and you think that you may qualify. If you have any questions about this, please contact one of the agencies listed below relative to your state. I did just want to encourage everyone to check out this list of important contacts. This is going to have all of the information you would need as far as who to give a call to if you had a question about a specific line of coverage or your health savings account, or you need to get in touch with the HR department or our broker's office. This is just a good snapshot of all the numbers you would ever need as far as contacting to get the information to answer your questions. And that about wraps it up here for our video. Just wanted to say thank you to everyone for all your hard work. Like I said in the beginning, these benefits are here for you, and we encourage you to take full advantage of them, ask questions, join the wellness program, and just live your happy and healthiest life.